So for treatment and management of cardiovascular diseases, we have the treatment type which are using drugs. That's the pharmacologic treatment, right? Then we also have the treatment type that you are not using drugs. You're just trying to educate the patient so that they can be their own doctor. All right. So one of these methods is what lifestyle modification. So in trying to advise a patient on lifestyle modifications, what are the things that you are looking for to tell the patient? All right. So lifestyle modifications in treatment for lipid disorders, also known as what cardiovascular diseases. All right. So these are different things like they should start taking a healthy diet, which is rich in what? Fruits, vegetables, and fish. Okay. No red meats. Then they should do morning walk. That's a soft way of telling somebody to start doing exercise, right? They should reduce stress. Anything that is stressing them. If they have their own money, they can quit their job. All right. Then they should always have a good sleep. They should cut the fat intake, like all those yogurts, ice creams, all those burger, okay, all those what do they call it? All those junks, all right, all those you cut the junks. Then they should avoid alcohol intake. So let's see what we have in the lecture. All right. So this organization actually recommend a comprehensive strategy to controlling lipid levels as follows. The patient should have a lifestyle modification, which we'll talk about. They should control all modifiable risk factors. Modifiable risk factors are the things that are predisposing you to having a cardiovascular disease that you can control. So you try controlling them early. Then they should undergo some pharmacologic treatment. Okay. So for the lifestyle modification, you can start doing some physical activity like a 30 minutes walk every day, 4 to 6 times weekly, right? And all these physical activities include brisk walking, riding a stationary bike, or the bike could be moving, swimming. They should start cleaning their house and scrubbing. Okay. So some people they actually employ people to be cleaning their house and all that. That thing made them lazy and they don't know that they're killing themselves. So you start doing all these jobs by yourself. Then next, medical nutrition therapy. The food you eat needs to be modified. That's when you advise them to start taking things like fruits, vegetables. They should start taking grains, fish, lean meat like what chicken, turkey, and the turkey should be skinned. All right, don't take turkey with the skin. All right, skin it. Then they should also reduce the intake of saturated and trans fats, which are found in commercially baked and fried foods. Right. Um, they should start taking what plant stanols and sterols like vegetable oils and onions. Right? They should start taking soluble fibers like what oats, apples, carrots, citrus fruits. All those things are actually what soluble fibers, right? So what do you got here? How to manage? Okay. The only thing important here is what reducing salt intake. I didn't mention it, right? Any other thing here I mentioned it, right? So this is how lifestyle modification can help you treat lipid disorders, right? Or help the patient be their own doctor in times like this.